Iliopsoas syndrome causes and treatment. Iliopsoas syndrome is a term used to describe the rupture, tearing, or stretching of the iliopsoas tendon and/or the iliopsoas muscle and inflammation of the iliopsoas bursa. Iliopsoas syndrome is caused when the iliopsoas suddenly and/or violently contracts, which causes the muscle fibers and connecting tendon to stretch, tear, or rupture. More often than not, the rupture is located where the iliopsoas tendon and iliopsoas muscle connect. As mentioned above, the close proximity of the bursa often means that iliopsoas bursitis is also present. Those at particular risk for Iliopsoas syndrome include those that participate in sports requiring sudden directional changes or side movements, running, jumping, and kicking. Symptoms include a sudden sharp pain over the iliopsoas, hip, and upper thigh areas. A palpable mass may be felt over the tendon insertion point on the iliopsoas. There may be a snapping sensation with movement. Pain may intensify with hip flexion, kicking, and when trying to lift the knee toward the torso. Local tenderness and stiffness in the hip. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice to your hip to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the hip. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your hip with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your hip with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Soak your hip with the Sinew Relaxing Soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The Sinew Relaxing Soak is particularly useful if you feel restricted mobility in your hip. The soak can be used by saturating a towel in the liquid and applying it to your hip. Soak your hip with the Sinew Warming Soak to bring warmth into the hip to drive coldness out of the damaged tissues, increase local circulation, ease joint pain, and increase range of motion. The Sinew Warming Soak is particularly useful if your hip is more painful and sensitive to cold or hurts more in cold weather. The soak can be used by saturating a towel in the liquid and applying it to your hip. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.